Thank you very, very much. Really glad to be here. Really excited to share about how medicines can affect the brain and behaviors. This is something I do a lot of when I see patients and families, and our favorite thing to do as geriatricians is to de-prescribe, right? Is to take away medications. All right, so next slide. Um, this is just an acknowledgement slide. Diane Terada already mentioned the sponsorship by ACL funding through Catholic Charities. And I am at the Pacific Islands Geriatric Education Center through the John A. Burns School of Medicine. Next slide. So what do we want to do today? We want to learn about changes in the body and the brain with aging. We want to learn about how some medications can affect your brain, learn about other treatment options, and learn what questions you can ask your health professional about medications. Next slide. Okay. Okay, we're going to talk a little bit about changes with aging that affect your medications levels. So as we get older, you can see a picture here, like liver and a kidney, they become less efficient as we get older. And this is a normal part of aging. And so as we get older, it will take longer to clear the medications out of our bodies. Also, as we get older, many of us will have more health problems, and oftentimes more health problems leads to more medications and or more vulnerabilities. And then, of course, if we take more medications, there's an increased risk for more interactions with other medications. And of course, there's also side effects from those medications, and those side effects can also add up. I want to make a special mention about alcohol. Alcohol may also be considered a drug because it interacts with many medications and it has its own cognitive side effects, right? Which is why some people actually drink, right? In order to have those side effects that relax or things like that. Also, some of the alcohol consumed when you are 25 will have a greater effect on the brain when you are 85, right? So we need to be aware of this. It's just not the same as it was when you were younger. Also, as we get older, our body composition changes. Some of us may notice we may have more fat, others may be less muscle. And when this happens, the medication that is floating around in the blood system, the bloodstream, they have less proteins to bind to, or they have more fat, um, or they get stored in the fat cells in our body, and so therefore are resulting in higher levels in the body in general. And those are some of those medication changes that we often see with aging, which is why we have to be extra careful. Next slide. Okay, so as we talked about, right? So brain changes with age as well. So sometimes as we get older, the brain structures and the abilities may change. So, for example, if we have dementia, right, we may have fewer cells in the body. Fewer brain cells in the brain, uh, or their connections may be destroyed, or there may be fewer or neurotransmitters, right? And so, if you combine that with increased drug levels, we have an increased risk for brain reactions. So, next slide. So what do we mean by brain reactions? We mean cognitive side effects. So our abilities to think, understand, learn, plan, and remember may be compromised. So while you may be familiar with cooking a pretty fancy meal for guests to come over, it may take longer, need to look at the recipe more, become a little bit more slower, a little bit more unsure of things like that. Those planning skills and learning skills. Other cognitive side effects include things like confusion or memory loss, hallucinations or delusions, and BPSD. What is BPSD? I'm going to talk about that in the next slide. But basically, BPSD is um, instead of just cognitive effects, you also have effects on the emotions and uh, emotional side of handling things. Some of these changes can be mistaken for dementia, which is a condition due to loss of brain cells that disrupts daily life and is not a normal part of aging. The difference is it's caused by medications, right? And so therefore it should be reversible. Next slide. So this is BPSD, the behavioral and psychological symptoms of dementia. So we may see things like psychosis, which is hearing things that aren't there, seeing things that aren't there, or believing things that to be true when they're clearly not. Um, uh, Agitation and apathy are also more common, uh, as well as depression, anxiety, and disrupted sleep patterns, right? If you have fewer brain cells in working in the body, they cannot handle the increased stresses or the uncertainties going around, and therefore we get these behavioral and psychological symptoms of dementia. Next slide. Okay, there are certain classes of drugs, certain categories of medications that we really need to particularly watch out for. And I've written them here, and we're going to talk about each one of these: depression, anxiety, agitation, medications for allergies, medications for sleep, medications for pain, and medications for urinary problems. And taking more of these drugs in each category can really add up your risk. Um, One of the common problems with a lot of these medications is that they have anticholinergic effects. So what that means is that you have lower um, acetylcholine, which is a neurotransmitter in your brain that's required for thinking. And when you have, and actually, when you have dementia, you also have lower acetylcholine levels, and that's why this combination is particularly bad. And when that happens, this anticholinergic effects, you may see more confusion, more dry mouth, more constipation, more sleepiness, um, more difficulty with urination or less urination, and also falls. Those are very common. Next slide. Next slide. Okay, and I'm going to let Camlin take over here.
Thank you. And I just wanted to say thank you for Dr. Nguyen for inviting me to speak with her today. She's an amazing advocate for our kupuna and a great speaker. So I learned lots of things when working with her. So the first area or class of drugs we wanted to talk about are ones that you can find over the counter or often called OTC medications. So these are medications or supplements that you can get at any pharmacy, such as Long's or Walgreens, that you can pick up and buy yourself without having the doctor order them for you or prescribe them for you. So even though they are available for you to just pick up at the pharmacy, they have its intended effects and possible side effects. So we wanted to make you aware of some of these concerns as well. So some of the common ones that we use are ones for allergies when we have like runny nose or coughing and sneezing due to changes in the weather, or maybe even things like fog. When we have fog, we might have more of these types of symptoms. Or we might have allergies to animal dander. So oftentimes we take these types of medications. The ones that we are more concerned about, especially for elderly, are the ones that are anticholinergic, as Dr. Nguyen talked about before. And these are ones that are called Benadryl or diphenhydramine or chlorpheniramine. These are commonly used to help with allergies. Sometimes people get itching or like a bad reaction to mosquito bites and may take these to help with itching. But these are really highly anticholinergic, meaning that they will lower your acetylcholine levels quite a bit and cause those other side effects that we're worried about, the drowsiness, maybe can cause some confusion, increase your risk for falls. And so these are ones that we want to be very careful about using and only use them if we've tried other things that haven't worked as well. And as we note here in the purple box here on the left that taking things like Benadryl very frequently or often, either for your allergies or itching, sometimes because it can cause drowsiness as a unintended effect. That's also something that's used to help treat people who have insomnia or difficulty sleeping. But if you're taking these medications like Benadryl a lot, this can actually increase the chance for problems and increase the chances of dementia when you use them for long term. So definitely we want to avoid that. Other things that you can get over the counter that we commonly use are cold medicines, things like cold and flu decongestants. So to help um, when you have stuffy nose, to relieve that stuffiness when you're sick or if you have really bad allergies. So things like Sudafed or pseudoephedrine are concerning, especially when we're elderly. These have different effects. These drugs can increase your blood pressure and your heart rate. And that can increase your chance for stroke or heart attack. So many cold and flu medications have decongestants like Sudafed, but many of them have combinations of different medications. So not only the Sudafed, but it might also include diphenhydramine or similar product to help prevent the runny nose. And so those you want to be cautious about and just make sure to ask the pharmacist if they are safe for you and if they have duplicate medications in them that you might be already taking as a prescription. The other class that we're concerned about as far as over-the-counter medications are ones that you can take for occasional dizziness or motion sickness. So motion sickness happens to some people when you are in a car or on a plane or on a boat and we feel very sick or nauseated. And so common ones used are things like meclizine or Bonine or the brand named products for them, or scopolamine. But these also can have some anticholinergic effects. And so these are ones that we want to be cautious about. So for the next couple of slides that we're going to be talking about some of the medications to be concerned about, I will be talking about the ones to be concerned about, and Dr. Wen will be highlighting things you can do to other options to treat some of these conditions that might be safer for you or the people you're taking care of.
Yeah, this is like my favorite thing to tell patients, right? Is try other things first because even if these aren't completely used, you can if this works partially, you can use lower doses of of the other medications too. So this will help you minimize the use of dangerous medications. So first thing, of course, try non-medications. Saline, nasal saline. You can buy that over the counter really easily. The spray or the rinse or the mist, they have the neti pots. Those are things. Those clear out all the junk in your nose and washes it out. So those are really great ideas to use. Um, the other things that you can get over the counter are creams, like anti-itch creams, or uh, such as the topical antihistamines or something like that, or cortisone creams. Moisturizers can be really helpful for itching due to dry skin. Cold packs also decrease the sensation of itching. And then antihistamine eye drops. So there's lots of different options for that. Now, clearly these are the same medications that you would take by pill, but by giving it topically, that means tiny dose on the surface, it attacks the surface with a smaller, it addresses the problem at a more local level, and you need a smaller volume, a smaller amount of the medications. And yes, it will be absorbed in the body, but it won't have as big of an impact because it's topical. And hopefully you use less of it. Of course, if you put it all over your body and you large area, then it still might cause a problem. But we're talking about localized use of these medications can help you address some of these symptoms. If you need, if it's not enough and you need to take some other medications, then I would steer you towards some of the other over-the-counter medications, such as Claritin, uh, Allegra, Zizal. These are different. These are the ones listed on the left-hand side, and that Dr. Masuda talked about. Those are kind of your first generation antihistamines, and those have the most anticholinergic side effects. The ones I'm listing on the right side are second generation, so they are actually a little bit more targeted with fewer side effects. I mean, it still has some. It's you're not steering clear of it, but it's a little bit less than the other ones. So these would be the preferred ones if you need to. With regards to colds, you can strengthen your immune system, right? With some vitamin C. You could take the nasal rinse, the warm steam. Menthol can help open up some airways. Herbal teas can also be soothing for your throat or things like that. And they have herbal teas with immune boosters and all kinds of things, right? You can take zinc. So there's a lot of uh, uh, those types of treatments that would be helpful as well. And if you get dizzy, yeah, check your blood pressure and pulse. Maybe your blood pressures are low or maybe too high. Or if your heart is beating very, very rapidly, lie down. Make sure you drink enough fluids. Stand up slowly so you don't have that quick increased risk for falls as your blood pressure drops. May try ginger tea for nausea or acupressure and things like that. So those are some things to try that do not require medications and may help you stave that off. Next slide.
Before we move on to the next slide, just to add
Yeah,
clarification. So for the cold and flu, the concern is specifically with decongestants. So
yeah,
things like Sudafed that can increase your blood pressure and
yeah.
heart rate. So those
Mhm.
are the concerns because high blood pressure, high heart rate can increase your chance for a stroke or heart attack. So it's not all cold and flu, it's specifically the ones that have decongestants like Sudafed.
Thank you. Thank you.
Thank
All right.
you. So the other class of medications that um, are different medications that we use to treat sleep. Some of them can be concerning for some of the adverse side effects, especially when we get older. And as we get older, we may encounter more days where we have trouble falling asleep and staying asleep, which most of us know as insomnia. So this can be very frustrating when we have insomnia. Um, and there are drugs that can help you fall asleep, but many of them can cause these concerning side effects and should only be used for a short time. So example of ones that we are particularly concerned about, we just talked about. So the first generation antihistamines, diphenhydramine or Benadryl, like its unintended effect is to cause drowsiness. So it is often marketed in over-the-counter products to be used to help you with sleep. So these are concerning because it can cause you to fall asleep, but people might also feel groggy the next morning where they're very tired throughout the whole day. And so that can affect how you think and your ability to do things and increase your risk for falls as well. So the other class of medications that have in the past and sometimes used now to help with sleep are called benzodiazepines. So very fancy term. We often refer to them as benzos because it's easier to say, but all of these drugs are prescription medications that all end in PAM. So lorazepam, alprazolam, are examples listed here. And these medications, because they're very concerning for some of their side effects, they can be addictive. They do have special regulations on how a doctor prescribes them for you, and you can only get a certain amount and you need to fill them within a certain time period as well. But these drugs, main concern is that they can be very addictive. And so that can be a concern. It can also cause you to feel kind of loopy as well. And because it's helping you sleep, drowsiness, it can have long-term or extended drowsiness as well that can affect how you're thinking also. And the drug manufacturers wanted to find different drugs to help people sleep that didn't have such significant effects as these benzos. So then they created these Z drugs. So these Z drugs, they're called that because they have Z, the letter Z in their name, like Zolpidem or Ambien, or Zaleplon or Sonata. And so these are very similar to benzodiazepines, but they were thought to have less of the side effects that occur with them, but they were found to have also different types of side effects where it can cause kind of like abnormal dreams or thoughts when you are sleeping, cause sleepwalking as well. So these also can be concerning for everybody, but also these side effects may be more apparent as we get older. As mentioned, some of the drug levels will stay. The level of drugs in our body will stay in us longer when we get older, as we're not able to clear them as quickly. And then lastly, as mentioned before, alcohol, we consider that something we want to know about for pharmacists and physicians, because this has a lot of effects on our abilities for our brain to think and how our brain reacts. So it also helps us relax. And so people think this might be helpful to get to sleep if we're not, have racing thoughts, that it can help with that. But it actually, as you are sleeping, will disrupt your sleep patterns and your sleep cycle and decreases your quality of sleep. So although you can maybe fall asleep while using alcohol, you may still wake up feeling unrested because you didn't have good quality sleep. And for some of us, that means you don't have enough of that REM sleep that we need to have have our brains rest for a good amount of time to be well and functional the next day. So, Dr. Wen, what can we take besides these medications, or what can we do to help us sleep?
Well, first thing to do is don't make the problem worse, right? So don't maybe, caffeine is a drug too. We think just like alcohol is, and we enjoy it because it tastes good, but it does have caffeine, and caffeine can stimulate the brain and keep people awake. And the body, as it gets older, metabolizes it differently, and you may have more caffeine in your body later on in the day. So maybe try to make sure maybe try to avoid caffeine or take it early in the day, and no fluids after 6 p.m. One of the big issues that people have is getting up at night to pee, right? But if you don't drink, if you do all your fluids in the daytime, in the morning, especially in the morning and the daytime, um, then you probably don't need to get up as often after you go to bed. So no fluids after 6 p.m. Another good strategy is exercise earlier in the day. You get all that energy out, it's good for you anyway, um, cardiovascular wise, but it'll also make you tired. And so hopefully less, um, more sleep, better sleep at night. I want to caution you about exercising late in the day. Exercising late in the day tends to keep people awake. So don't do that. Reduce stress as best as you can, especially if you're getting ready for bed. You know how we have kids. We always do this nighttime routine where you relax and maybe do some deep breathing. Just reduce your stress. No screen time. Sleep hygiene. Don't lay in bed awake and just worry about falling asleep and trying to shorten. I know you're tired during the day if you don't sleep all at night, but if you shorten your daytime naps, you have a better chance at sleeping at night, or staying asleep at night. So definitely have to do all these what we call sleep hygiene strategies. Uh, and if that doesn't work, uh, try Tylenol. People say, but Tylenol is not a sleep drug? But I'll tell you, sometimes people have a little bit of aches and pains as they get older. And when you are sleeping or resting, sometimes you notice your body a little bit more. And if there's some discomfort going on, that may impact your ability to relax. And so I've actually had folks just try Tylenol before they go to bed, and that's enough to help them not have pain to sleep. So sometimes that's a helpful thing to try. Um, Melatonin is also available over the counter, and different people may need different doses, but tends to be, um, I think, better tolerated um, for folks. And I'm going to let Cameron talk about, discuss her opinion on that later on. There are other over-the-counter things, supplements that they do sell for sleep, like tryptophan and magnesium supplements, and magnesium, and also other supplements like valerian root, kava, hops, or even chamomile, as in chamomile tea. But I want to caution you also, even though they're sold over the counter as supplements, there are drugs in them as well, and they also have drug interactions. And people should use with caution, especially if you have like kidney disease or things like that. So you should always check with your pharmacist about any potential interactions. There are also foods with tryptophan and magnesium that are supposedly helpful to help you sleep. So that's what the thing for milk and cookies comes in, right? Milk, snack, yogurt, other dairy products, bananas, seeds, nuts, alcohol, fish, tofu. There are certain foods that tend to have higher quantities of these chemicals, and that may help. And if you need to absolutely use something because you've tried everything else and it's not effective, then there are medications that are less less awful than the ones we talked about earlier, and that includes the melatonin. I would say low doses if you can do as low as dose as possible. Same with trazodone. Trazodone is actually trazodone and mirtazapine. They're actually in the class called antidepressants, but they actually have a side effect of sleepiness as well. And but they're less anticholinergic, so that's preferred. And then and if you have to use a Z drug, right? So Romeltion or Rozarem, it's a shorter acting Z drug, so maybe less chance of having that hangover effect later on, but still try to avoid that as much as possible. Kamlin, you want to comment on any of these?
No, I think you said it all, but a main thing is really to talk to your doctor about different options that are available to you, and even trying to discern other causes for sleep, trouble falling asleep. Even things like sleep apnea can be other reasons why you don't feel well rested and have trouble sleeping too. So those are things to talk with the doctor or the pharmacist with about drugs that you want to take.
Yes. Yeah, definitely talk to them because if you're taking any of these drugs, you don't necessarily want to stop them cold turkey either, because that can be very dangerous. And so we're going to have to talk to the doctor about a plan for transitioning to other safer methods if you have been using these for a long time. Next slide.
So, another condition that is often treated with some medications that can be concerning is when we have depression or feeling sad or have little interest in things on most days of the week. Um, so, some dementia behaviors are actually a manifestation of depression and should be treated, but however, mild to moderate symptoms in older adults with dementia, it's better to be treated without drugs because it can actually cause more problems with some of the side effects. Um, in general, for depression, as we mentioned before, you definitely want to talk with your doctor about ways to treat it. But the ones we're most concerned of medications to treat depression are listed here. So the nortriptyline, amitriptyline, are the more common ones that may be used to treat depression, but we do have newer agents or newer drugs that have less of some of these anticholinergic side effects. So all of these drugs listed here as far as avoid use examples are the ones that have some of that anticholinergic effects. But we do have newer agents that have less of those effects. And sometimes some of these agents, like amitriptyline or nortriptyline, are used for other things too. So just be cautious about use of them. And as Dr. Wen said, for these drugs as well, you don't want to just stop them cold turkey if you are already taking them or the person you're taking care of is already taking them. You want to come up with a plan on how to slowly decrease the dose of these medications and transition to something else. So, Dr.
Right.
Wen, what are some other things we can do for depression?
I am a big fan of non-pharmacologic treatment for this. Uh, First thing I would say is first have a medical workup to rule out medical causes. Sometimes people may be having a thyroid issue. Your thyroid may be creeping up, or hypothyroidism or things like that. And that can mimic depression as well. Or if some people, or even you got to work up and make sure you rule out dementia, right? And other And some other medications can actually, like some cardiac medications or some other medications can actually make you feel tired and depressed as well. So really have to be thinking about what are we ruling out and make sure it's not caused by something else you're taking. And just make sure all your labs are good. You're not anemic, your thyroid's good, your vitamin levels are in a good range, those kinds of things. And then the non-medication approach is exercise. Exercise is fantastic. It's actually, I think it bumps up your endorphins and other hormones. And physical and occupational therapy. If you're kind of not functioning as well as you used to, and you really want to be able to do more things, and setting a goal and having PT and OT to enhance function will give you more encouragement in your life and being able to be more independent and do more things. Um, and exercise, and then sometimes changing the environment. Maybe it's not good to just sit home alone in the dark all day long, and maybe you need to go out and maybe set some goals, or even uh, something like a senior center, an adult daycare center, something to just change the environment, change the social interactions. Maybe, we are social creatures, as even people who are introverts, right, require some socialization. And so I think really trying to focus on being more intentional about scheduling um, friends and family and other interactions to happen more frequently. Games are amazing, especially if you can get intergenerational games going, not games that you play by yourself, but games with others. Um, and scheduling those pleasant activities is something. And animal therapy, anybody with pets knows that animals can really, that companionship can be really, really therapeutic. There's a concept called behavioral activation, which I just want to mention, um, which which is basically the outside in approach, right? Instead of taking the drugs to internally change your chemicals so that you can feel better, right? You do stuff on the outside, like the exercise, the environment, the social interactions, the scheduled activities, things like that. The outside when can impact, especially if you're doing the things that you enjoy doing, impacts how you feel. And so it's the outside in approach, and then in turn, you that is instead of the downward spiral, it's the upward spiral. So that those are definitely things we need to do. And oftentimes people who are depressed can't do this on their own, right? They need somebody to champion them for this, and be a support and to help and encourage this all to happen, because it's going to take a bit of effort. So I would encourage those efforts, and don't do it by yourself. Enlist a number of friends who can help with this as well. And antidepressants, for especially for people um, with dementia, cause more side effects, more problems than they benefit. And so, but there is a role. There is a role for antidepressants, especially if the depression is severe. So really only reserved for people with severe depression, uh, especially if they are living with dementia, because the side effect profile is just so extreme. The medications that are preferred in these situations include things like citalopram or Celexa, escitalopram or Lexapro, mirtazapine, sertraline or trazodone, because those have a much better side effect. But of course, they have their own set of side effects as well, which also need to be looked after, including low sodium or other chemical imbalances, and so need to be monitored. So no, there's no free ride, but the more you can minimize these medications, the better. And oftentimes, I would use these medications kind of to push people out of the rut, right? And then hopefully, if we can maintain those external non-medication approaches, um, then we can eventually not need the medications. But sometimes you need an extra push to get out of that rut. But definitely, this depression is not something we need to live with, right? This can be managed, and uh, I would encourage you to talk to your doctor about different strategies for this. Any other comments, Cameron?
No.
Okay, next slide.
So, another class of medications we want to make you aware of are ones that are used to help treat anxiety. And typically, this is for anxiety that is so severe where you have excessive worry or fear, or unease about future events or situations that affect your daily life. So this is when it's very severe, where you can't even function as you normally do, like you're afraid to go out because you're worried about something bad happening. Because we all get anxiety here and there, and it's not something we necessarily have to treat. But when it gets that severe where it affects your daily life and you can't do your normal daily functions, then that's definitely a time where we want to talk about possible medications or even other treatment options. But the ones that we want to be concerned about, again, are the benzos that we talked about earlier. These medications can help you feel very kind of relaxed, but it also can affect how you think and how you kind of like make decisions as well. And so definitely something we don't want to use chronically. It may be used occasionally, especially if you have really bad anxiety when you're going to take an exam like a MRI exam. Sometimes people may need a little bit of this to take right before that test, but it's not something we use long term to help with severe anxiety. We mentioned before some of the concerns, the side effects as well. And I think many of us have already heard about marijuana or cannabis as somewhat a way to relieve anxiety, but marijuana also can cause paranoia in some people, and that can actually worsen anxiety symptoms. And so those are some things to be concerned about with the use of these agents. And then relating back to some of the other things we talked about, or medical problems we talked about, sleep problems and depression can worsen some of um, our feelings of anxiety, especially with people with dementia. So it is very important to kind of address those problems as well to help prevent further medical conditions such as anxiety, especially in those with dementia. So, Dr. Wen, what else can we do to help if we have severe anxiety?
Well, first thing, take a deep breath, right? Take a deep breath, it'll be okay. So, non medication approaches. Oftentimes, especially with people with dementia, this is a very, very common problem. When you don't really understand what's going on, it can be very, very anxiety provoking. And if you can't express your needs very well, it's also uh, very stressful, right? If you can't express what you need, then you're not feeling safe. So we need to address those physical needs like hunger, cold, pain. Those are just basic physical needs that we need to make sure. Just like, um, children get cranky, right? Or worked up, right? They kind of go spiraling if they don't have a snack or if they're missing their nap, right? Same thing. We're all like that. We need to address our basic needs. Also, people with dementia are very sensitive to the environment. It's what we call stimulus bound. Whatever is in front of them, whatever the environment is, that impacts them directly. So it's really important to make sure the environment is um, not overstimulating. So, if we can get a calming environment with not that's not too boring, right? The gentle sensory stimulation or soothing music or things like that, those are really, really very powerful. I just want to, I didn't put it in here, but music therapy is very, very powerful. Um, and I I witnessed it firsthand, right? I have a mom with dementia, and she gets very, very, very anxious. And fortunately, She responds to music. And sometimes if you play the wrong music, the ones that are more activating or cheerful, she kind of gets more anxious. But if you play the music that's super slow and super calm and super chill, then she just comes right down like magic. So it's better than medications. Um, the, that those type of things. Other other ways to kind of bring the temperature down, right? It's things like reminiscence, thinking, remembering the good memories, right? Um, Cognitive behavioral therapy, if dementia is not too advanced, right? Deep breathing, and other mindfulness practices. Things like Tai Chi, actually, Tai Chi or hula, right, can be, especially if it's the slow, smooth kind, that can really help people relax. Um, Exercise, scheduling that in can also help uh, reduce the anxiety, and also having a daily routine. Just as children need to have a routine every day, they seem to function better knowing what comes next. It's good to have and follow a daily routine, and those are the things that we can try. There, of course, sometimes, it's debilitating and you can't function. It's hard to even get to square one. So sometimes medication, just like antidepressants, right? If it's severe, you need to have something to get going there. So some medications that are helpful can actually be a lot of these antidepressants, and some of these antidepressants have a kind of an important anti-anxiety component to it. And so I mentioned a few of them here, like sertraline, or Zoloft, citalopram, or Celexa, escitalopram, Lexapro, or buspirone, or Buspar. And, I know that these days people are more prone to ask about CBD. So I would just say that, I mean, there's CBD gummies, CBD oil, all those kinds of things. And, surely must be better than cannabis. But I would say we have to be very careful. Just we need to beware of the formulations, as I mentioned earlier, right? Cannabis or marijuana, that has both the THC and CBD component. um, the THC produces a high. The CBD component does not produce the high, but it's sometimes it's not that clean, and maybe it still has a little bit of THC in there, right? Or other formulations. So this is not regulated by the FDA or anything, and so we really don't know what's in the formulation or the quality of it, or if it's changes from dose from one company to the next, and they're all not regulated, and we don't really know what's in there. So I just want to put a caveat out there if you do want to try it.
And just to add to that, for other supplements, they are also not regulated by the FDA. Um,
Hmm.
so those you want to look for a USP symbol on them. Those a USP is the United States Pharmacopoeia. It's a organization that helps to evaluate supplements to make sure that they are manufactured in a clean, safe environment, and that the ingredients that the um, company that's selling this product are actually in there and they don't have any other additives. So that's something you can look out for as well when you're buying supplements.
Yeah, thank you.
Okay, so moving on to agitation, as we talked about earlier, agitation for can be a symptom for people who already have some dementia. Basically, agitation is a term that just describes when we're restless or uneased or distressed. And I think sometimes, we've had in our own lives being agitated, and that can include when you're just moving around more, pacing, you have difficult time sitting or relaxing, and you're irritable. This also can contribute to difficulty concentrating or sleeping, and also anxiety or fear. So definitely, if this is something that's persistent, is a concern, and want to have treatments for them. But as we talked about before, benzodiazepines or benzos were in the past something that has been used to treat agitation in those with dementia, but based on the side effects we talked about before, um, not something we would recommend as the first thing you would use to treat this agitation. There are also a drug class called antipsychotics. Basically, the term for this class of medications are just to help prevent people from having hallucinations, seeing or hearing things that aren't there, or delusions where you're holding false beliefs. And typically, these drugs are used for people who have bipolar disorder or schizophrenia, which are mental health conditions. But more recently, they've been used to help treat some of these agitation behaviors as well. But these can also cause some concerning side effects, and some of them have some anticholinergic side effects as well. So ideally not the best medication to use firsthand. And as listed here on the bottom left, the antipsychotics have what's called a black box warning. So what that means is that it's a significant concern where it can cause some serious side effects. So especially in elderly or geriatric people, it can increase the risk for heart attacks or strokes. And then for all people taking these medications, it can cause movement disorders, meaning that it may cause difficulty like in walking, where it cause like shuffling effects, or cause involuntary movements of different parts of your body as well. So these drugs aren't recommended generally for treating agitation. And Dr. Wayne, what can we use to treat agitation instead of these types of medication?
Again, right, we're going to focus on that non-pharmacologic, non-medication approach. So addressing those unmet needs, right? Addressing the environment, making sure it's not overstimulated or unfamiliar. Or oftentimes, I get people who are just bored out of their mind. If a person is always busy their whole life, always active, always working, always busy, 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 and then they suddenly nothing to do, they can get quite restless, and they can start trying to find things to do, and and then of course those types of things they are finding to do are not necessarily appropriate. Um, can cause a lot of agitation as well. So really needing to find meaningful activities, um, things like musical therapy or gentle sensory stimulation, uh, you know, to just calm things down and give them a sense of purpose. And also people like hanging out with friends and safe environments and safe people. So something what we call best friends approach, which is basically just meeting their need for love and belonging and respect, treating somebody as if they're your best friend. So those are really important. In other words, don't you can do stuff to prevent agitation. So don't um uh I call it tada. I heard that from somewhere. It's um tada. It's um d don't agitate. Wait. Hold on. Sorry. Anyway, just prevent agitation. Don't push things to the limit, and just agree with them, and don't do stuff that you know are going to agitate them, asking them questions. Okay, and medications definitely if you need something for agitation. Often a lot of these times these antidepressants help. Antidepressants that may also cause a little bit of relaxation as well, especially at nighttime. So if they have hallucinations or delusions or in danger of hurting themselves or others, then definitely we need to have an antipsychotic, even if there is a black box warning. But maybe use a safer antipsychotic, such as quetiapine or Seroquel, or use as minimal a dose as possible, and don't use it on a standing dose. Yeah, TADA, right. Stands for tolerate, anticipate, and don't agitate. That's a strategy, right? So tolerate some activities you don't need to. You got to choose your battles. You don't have to fight every single one of them. Just tolerate it and anticipate it so you can prevent it and don't agitate. Thank you.
Thank you. So moving on to our next category. So pain is always something all of us have experienced at one form at one time or another, but there are different types of pain. So it's important to talk with your doctor about the types of pain that you have. Um, and especially for those that have dementia, untreated pain actually can be, if they can't communicate the pain that they're having, this can be expressed as behaviors that we talked about with the agitation, or anxiety as well if they're not able to express their pain or do anything to treat their pain. So these are things that we want to make sure that we address, but keep our patients safe or keep ourselves safe when treating these types of pain. Or treating pain. And as mentioned, there are different types of pain. So the medications that we would recommend should be specific for the types of pains that you have. Over the counter pain medications that we're probably already familiar with are what's commonly referred to as NSAIDs or non-steroidal anti-inflammatory drugs. And these are your ibuprofen, Motrin, Advil, or naproxen, such as Aleve or naproxen. And so these drugs, as we've all probably taken before, can be helpful when we have headaches or muscle pain, muscle strain, or some of us may have taken it if we have gout symptoms. And so these medications do work effectively to help these types of pain. But as we get older, they also have some side effects that might become more apparent to us. So NSAIDs don't cause the low levels of acetylcholine, but they also have different side effects that we're worried about. Um, so the NSAIDs help to lower our perception of pain, but they can also help reduce swelling, which can help reduce pain too if the pain is due to swollen muscles and things like that. But NSAIDs can also increase the risk for bleeding. It can also help us retain water, so it can increase swelling in our feet or legs. It can also increase our blood pressure. And again, we do want to prevent our blood pressure from going too high because that increases our risk for heart attacks or strokes. So in general, these are ones that we would be cautious about using them, especially not using them long-term or chronically as well. And
And
so,
kidney,
Dr.
kidney
Nguyen,
too. Kidney
yeah,
effects.
sorry, kidney function, it can decrease our kidney function as well. Dr. Nguyen, what are some other remedies we can use instead of NSAIDs?
Okay, so if you have, you fell and you have a sore bum or whatever, right? And you bruise yourself, right? Hot and cold packs. Those are very, very helpful. And even if you do take medications, try that, right? Because sometimes that can help ease things out a little bit. Sometimes when you have a traumatic event, sometimes your muscles can have go into spasm. You twist something or whatever, right? So sometimes a little stretching, massage therapy, um, physical therapy, acupuncture, chiropractor can help align things. Electrical stimulation can sometimes also help. Those are usually done by physical therapy, um, and that can help with healing as well. Um, and if it's a chronic pain, then you might try stuff like meditation or psychotherapy or biofeedback, things like that. Um, there are other over-the-counter medications like acetaminophen or Tylenol, as long as you don't have liver problems, um, which I mentioned earlier, can be very, very helpful. And then, as I mentioned at the very beginning, there are topical skin products. So if something you can put on the skin, treat locally, um, uh, it doesn't absorb as much and only absorbs locally. So things like menthol-based topical creams, things like Icy Hot or Bengay or Salon Pads, and some of these topical products, they actually may have lidocaine in it or Tiger Balm. Tiger Balm has menthol in it. right? So those are the things that can just really help with relieving that um, the local pain. There's something called Voltaren gel, diclofenac, which is actually an NSAID, as we had before, but it's used um, um, locally. So of course, so you don't get as high of a dose. So as long as you don't put it on lots and lots of different areas on your body, like on every joint, on both your knees and your elbows and your shoulder and your back, then you'll wind up getting a significant amount of NSAID absorbed, and you'll still have the same probable side effects. But if you just use it topically, um, in certain areas, it can be um, very, very effective. And it's really best if the pain is not deep. It's like all the topical stuff. It has to be kind of near the surface. Capsaicin cream is a very interesting medication. What it is, it's actually made out of chili peppers, and it depletes some of the pain uh, chemicals in your nerves, and so you don't feel as much pain. Now, when you apply it initially, which you should do at the lowest concentration, the 0.025 formulation, you apply that like 4 times a day or so, and then it depletes this chemical, this pain chemical, neurotransmitter. Um, at the nerves, and then if you increase the doses, then it actually gets more and more effective. It may feel like burning when you first apply it, but just like when you eat chili peppers. But then as your body kind of gets used to it, the nerve cells get used to it, then it actually can be quite effective. But you have to be careful when applying this cream, um, um, not to rub it in your eyes or your mouth or anything like that. Um, and then there are prescription non-steroidal anti-inflammatory drugs like Celebrex, which has less GI effects in terms of ulcers and bleeding, but it can still be problematic for people with kidney failure. I also want to mention NSAIDs in general. Um, it's especially in people who are older and have dementia. I've seen it cause confusion as well as some cognitive dysfunction as well that stops when you stop taking it. And so really trying to stick with the lower doses is or avoiding them altogether is really the best. Next.
Okay, so other classes of medications that are used for pain include opioids. So ones that are examples of this are morphine, oxycodone, and tramadol. And as some of you have already seen in the news, these are medications that are highly addictive and can be concerning for that, but also other side effects. And typically now this should be only used for extreme pain, severe pain, such as after major surgery, like back surgery, or if you have cancer, not like what's called metastatic cancer, where the cancer is spread throughout your body. It can cause a lot of significant pain, and definitely should only be used temporarily if we can. Mainly because these drugs can make people feel loopy, very drowsy, and that can increase the risk for falls. It also slows down your breathing, and in high enough doses can cause you to stop breathing. And so that's where you've seen in the news patients who have died, or people who have died from overdoses or high doses of these medications. And definitely there is a higher risk for death when you combine these opioid medications with other medications like the benzos, or sleep aids like Benadryl or alcohol as well. And these medications, as mentioned, can be addictive, which means that you crave the medication, you need to have the medication, even though your pain is not as severe, and you constantly need to have these medications, which can be a concern because that increases your risk for taking higher doses and could cause someone to die because it stops their breathing. Because of these serious side effects, it's now recommended that if you get a prescription for a drug in this class, these opioid medications, that you also get a prescription for something called naloxone or Narcan, which is a medication that can reverse the effects of these opioids. In the pharmacy, you pick up the opioid from, such as oxycodone, they can also give you the naloxone or Narcan, and you can ask the doctor who prescribed the medication for you for a prescription for that as well. It's a nasal spray, so it's something you stick into your nose, and you want to have someone you're living with or close with that you see all the time learn how to use it, because if you do have that severe reaction where you're not breathing anymore, you won't be able to do it to yourself. You would need somebody else to do them for you. So definitely something not first line for just regular mild or moderate pain, something we'd use only for severe pain. And then there are also classes of medication called muscle relaxants. Basically, they do is what they say. They try to relax your muscles. So if you have things like pain from spasms where your muscles are kind of spasming or cramping, they have these types of medications listed here, like the baclofen, methylcarbamol, and tizanidine. These are all prescription type medications, or even things like Flexeril, cyclobenzaprine are often prescribed for these types of pain to relax your muscles or cramps. But many of these also can cause dizziness or drowsiness or confusion. And some of them do still have some of that anticholinergic side effects. So ones we wouldn't use very frequently or first line, and definitely not something we want to use all the time, just intermittently. So Dr. Wayne, what are some things we can do instead of using these types of medications?
Okay, well, it's important to actually realize or figure out what type of pain this is, right? Uh, uh, Sometimes, like if it's a bone pain or if it's a nerve pain or something like that, then other medications may be better. For example, the anti-seizure medicines like gabapentin, that's Neurontin, or pregabalin or Lyrica or lidocaine patch, those are really effective for nerve pain. So if you have like a pinched nerve in your back, or if this pain feels like it's numbness or tingling and it comes and go at will and it's not associated with movement, then if you take a medicine that reduces the nerves from firing so much, such as these anti-seizure medications, that can be they can target it with that type of medications because the opioids don't take care of that type of a pain as well. So it's really important to work with your doctor and figure out what type of pain is this. Um, uh, so the other types of non-prescription medications include things like antidepressants I put here because things like duloxetine or Cymbalta is an antidepressant. However, it actually has effect for nerve pain as well. So sometimes you might see antidepressants used for nerve pain or anti-seizure medicines for nerve pain. Other NSAIDs we talked about earlier was that Celebrex or the celecoxib, which is the safer um, NSAID, but it still is an NSAID. So definitely continue to use. You may need those for short course if needed. Um, Other not, especially if you have the muscle spasms, things, so make sure you drink plenty of liquids, right? Liquids can help you reduce muscle spasms, or use warm compresses, hot packs, lots of stretching, massage, movement. Um, Sometimes if you just sit still for too long, right, your muscles kind of get tight, and the tight muscles in turn cause pain. So um, making sure we take care of our physical bodies in physical ways. Um, there's herbal teas, there's over-the-counter supplements, as I mentioned before, like magnesium supplements, and sometimes people use for cramps and things like that. But you really also have to be careful. You should know what your kidneys are like, beware of kidney dysfunction, and really maybe try those topical creams or sprays or patches. But most of all, talk to your doctor because that they can help you tease out which type of approach might be more effective. Next slide.
Okay, so moving on to another condition that typically starts occurring as we get older, urinary incontinence. So the ones we're medications that we're concerned about when treating urinary incontinence or overactive bladder treatments like ditropan or oxybutynin and totarodine. So these drugs also have those anticholinergic side effects as well. So those can be concerning. And keep in mind with urinary or urine incontinence, generally it's just a term that means involuntary leakage of our urine, but there are different types of urinary incontinence or symptoms that contribute to this condition. Sometimes we might have this when you laugh or sneeze, we might leak out some urine, or sudden feeling of having to urinate or pee. And then after you urinate, you still feel like you have to urinate, even though you already went to the bathroom. So it's important to talk with your healthcare provider, your doctor, to evaluate to make sure that they have appropriate type of urine incontinence, and that way they can make a better decision on a more appropriate medication or treatment for the type of urinary incontinence that you have.
Yeah. So, what are some non-medication ways to manage? Let's go back again.
Yes,
Non-medication
sorry.
ways to address this urinary incontinence or urinary frequencies. Well, avoid coffee, tea, or alcohol. All those types of things are actually diuretics, and so they actually stimulate your bladder to go. So, and then also, if you're taking a water pill, make sure you take it earlier in the day when you actually have easier access to the bathroom instead of overnight, right? So, limiting fluids after 6 p.m. Diabetes, when you have high sugars running around in your bloodstream, that can trigger a lot of urination as well. So getting those sugars under control will help you with the volume of urine that you are needing to get rid of, and also preventing constipation. Constipation also contributes to urinary retention and leaking. So the way you can help the doctor figure out what's going on is make a voiding diary, so you just keep a track on a piece of paper log about what time you go, and how much was it, and what was the circumstances, and the symptoms that you are having. And so keeping that voiding diary will help your doctor figure out what type of incontinence you have, and then they can figure out the right treatment for it. Um, uh, Other than that, you can also adapt the environment. If you can't make it to the bathroom fast enough, then get a commode or a urinal at your bedside during overnights, right? Or using raised toilet seat to make it easier for you to use the toilet. Or having physical therapy or occupational therapy to help you be able to do that more independently and more quickly. Um, or changing, adapting your clothes, like elastic pants or a dress or something like that, so that you don't have to fumble with buttons and zippers and things like that. So that can help as well. Having a toileting schedule helps, maybe like, not just, oh, I'm going to need to use the bathroom before I leave the house just in case, but also like, and then while awake, I'm just going to preemptively sit on the toilet every 2 hours or 3 hours, and not instead of waiting for the urge. There's such a thing called bladder retraining as well for people with urinary frequency. There's Kegel exercises for women who've had a lot of babies, and the tissues around that area are very lax and loose, um, and so they don't hold up the bladder as easily. There's a technique called double voiding, where you go and then you wait a little bit and then try again and empty the second time to make sure you completely empty it, so prevent you from going back again. And then, of course, there's some medications, right, that can make things worse. And so you need to stop those offending medications, and you should just ask your provider or pharmacist to review your med list. Other strategies, depending on, of course, what type of incontinence you have. Very commonly, men have a benign prostate hypertrophy, where their prostate is so large it blocks the urine, and having a TURP, or a transurethral resection of the prostate, a little roto-rooter, can help relieve the symptoms without medications. And for women, using vaginal estrogen or pessararies or inserts can be helpful for for the tissues underneath in your that hold up your bladder. So those can help strengthen those tissues. Next slide.
So
Okay.
definitely, we want to make sure that you stay safe on medications, or the people you're taking care of stay safe on your medications, and to prevent some of these effects on our brain and our memory and how we think. So always make sure to talk to your healthcare professional, or your person you're caregiving's healthcare professional, whether that be the physician. They have nurse practitioners or physician assistants now that you might be seeing. And it's always helpful to bring your medications with you to your appointments, or a list of your medications, but not only just your prescription medications, because your doctor most likely is aware of those, but even your over-the-counter supplements, vitamins, even Chinese herbal medicines, stuff that your grandma made you take when you were young. Any of those types of things, it's helpful to discuss this with the physician, healthcare professional, or pharmacist, because some of those ingredients and those things may cause some inadvertent side effects, or interact with your other medications as well. So always be open and talking with your healthcare providers about these can be helpful. And for typically, you see your physician or your doctor or healthcare provider on a regular basis, maybe every couple months. But the pharmacist, anytime you go to the pharmacy to pick up your medications, ask to speak to the pharmacist if you're interested in taking a supplement or something over the counter, and ask them about concerns or interactions or possible side effects. But you can even call the pharmacy that you pick up meds from and ask them these types of questions as well. And really, this is to help keep you safe, or the person that you're taking care of to be safe as well. And then
Okay. This is one of the most important slides. Encourage you to ask questions. You don't need to be afraid. If they give you a medication, a new prescription, you should ask, why do I need this? What is the name of this medication? Why do I need this? How should I take the medication, right? Should I take it in the morning, at night, with food, without food? And how long will this medicine take to work? When can I stop it, right? Is it forever? Is this temporary? Does this medicine have side effects on my brain or my body? And when should I call you about them? Or could this medicine affect my brain, right? How can I protect myself from having these cognitive side effects? Can I take this medication with other remedies like vitamins, natural products, and other drugs? And also make sure you ask, are there non-drug treatments that might be safer or can augment the treatments, or might be more effective, or alternative drugs with fewer side effects, right? Or, of course, you can always try a smaller dose as well. Like, can I take half a pill to try first? Is it possible to take a smaller dose and then titrate it up as needed? We have a mantra in geriatrics: start low, go slow, right? So it's always uh, better than taking a high dose and then having side effects and then cutting down. And then periodically you should ask, do I still need to be on all of these medications? Is there a time to consider that maybe you don't need so many? So definitely ask lots of questions.
And I think most patients who are above 65 may have Medicare. So one of the benefits with a Medicare is your annual wellness visit. So that's a great time to ask about your medications. Do I still need to be on all of these medications as well? Because that's usually time cut out specifically to try and prevent you from having problems in general, not just from your medicines, but for your health as well, preventative concerns
Hmm.
they want to address, and your annual wellness visit. So it's great to
Hmm.
have an annual wellness visit if you have Medicare, because it is free to you. There's no co-payments, and a good time to address some of these questions. The other question I would suggest to ask your patients, as we heard with some of these medications, that you shouldn't stop them abruptly all of a sudden. Talk to your doctor about, if I want to stop taking this medication, do I need to decrease the dose, or can I just stop it entirely? Because some medications can cause some rebound effects or other effects as well. But definitely, yes, ask questions. You are the patient. This is all about you. So when you see your providers, it's your time to ask questions.
Okay, so on the slides you have references where you can go Google and look up the CDC and the FDA and other brain health websites. So feel free to explore those on your own. And we are going to open up for questions.